Everybody, thanks for joining me on, I think for the most part in the country, it's a beautiful day. So we will get started. We're going to talk about rehabbing pets at home. And I'm not sure, I posted a blog, I think it was earlier this month, about this topic, so you can refer to that. And I think you can always go back and rewatch this at home. And my screen. Okay, so we're going to talk about why do we do rehab at home and who is the best patient. Of course, that would be your own. But we're going to talk about some differences in patient signalment, if you will. We're going to discuss the importance of weight management. We're going to differentiate the different types of pain scaling there is. And we're going to discuss multimodal at-home therapy. And you know, I could probably do this lecture a couple different ways, but knowing that hopefully the end of the COVID era is on the horizon, you know, this is going to be a great way to move forward. So one of the things that we know, and I'm not sure of the diverse population we probably have online right now, so whether you have a puppy or whether you have one of those old, maybe overweight Labradors that has had a previous cruciate ligament injury or has osteoarthritis. What we do know is that following any of these injuries, a lot of patients will lose 1/3 of their muscle mass after such injury. And it can take over a year to gain that back. So we know that rehab will help us increase the speed of repair, help us increase the strength in our patients, and endurance, which is also important. Will decrease pain, and there'll be definitely positive psychological effects for the patient and the owner. And the other important thing is that we can hopefully prevent future injuries through owner education and how they modify their dog's lifestyle. So I just mentioned we will decrease pain, increase range of motion, which is actually pretty important. We will talk about conditioning and weight loss and the prevention of future injuries. Now, let's look at what the best rehab patients are. So right off the bat, post-operative patients, orthopedic and neurologic are our biggest candidates. And I saw today in the office probably 3 dogs that were out on a beautiful day walking through the park, all of a sudden took off after something and came back walking on 3 legs. So we need to remember on a beautiful day, especially if we're talking about our short-nosed breeds like our French bulldogs, that we have to be careful about letting them, you know, run full throttle because all winter they've been probably cooped up inside. Soft tissue injuries, muscle sprains and strains. We can do a lot with that at home. Neurological conditions. I know that we have, I think just last week, I saw 4 dachshunds that presented with back injuries, flare-ups, etc. Degenerative conditions such as osteoarthritis and obesity contributes to actually everything that I have just mentioned. So I'm going to kind of go back and harp on the weight management issue. And then on top of that, conditioning is really fantastic. All right, so does rehab work? Well, you know, the interesting thing about rehabilitation, and in the veterinary world, we have to call it rehabilitation. We can't call it physical therapy because that is actually a protected human term, because physical therapists go to school for 4 years to get that degree, and it's really important. And veterinarians who are really successful in their rehabilitation practices usually do partner or consult with a physical therapist. And it's pretty wonderful when all that comes together. So some of the research in dogs and proving that rehab works. This is actually a paper published in Switzerland. And this is a box and whisker plot showing dogs in group 1 on the left received intensive physiotherapy. These dogs all had a condition called degenerative myelopathy. And if you have a German Shepherd, a Doberman, some of the large breed dogs, degenerative myelopathy is a very common inbred condition. So the dogs in group 1 received intensive physiotherapy and they live significantly longer. If you look at the curve on the left, it shows that they lived almost 400 days, where the dogs that did not receive any physiotherapy only lived 100 extra days. So it's really important. And the other thing that it sort of makes sense if you think about it, there's a lot of a burden on an owner when they're lugging around a 65-pound Doberman, a 100-pound Bernese Mountain Dog. You know, all these dogs, it takes a tremendous toll on an owner to do that. So it's very important that we sort of do prehab, pre-rehabilitation on these dogs, because an ounce of prevention is really worth more than a pound of cure. This is a study done at the University of Tennessee that was presented at the Veterinary Orthopedic Society, and it showed that following rehabilitation of stifle surgery, which is probably one of the most common surgeries performed today, probably the most common orthopedic surgery performed today, that the dogs returned to excellent physical condition in a shorter period of time. And again, that's really important if an owner is sort of lugging around maybe a little bit of an overweight Rottweiler, if you will. So we know, and it just makes sense, that rehabilitation works. So we'll talk about patient selection. And again, the best patient is your own. But one of the things you kind of have to understand is that going into it, what are you starting with? So if you look at the black and white photo on the top, that is a very old dog. That is actually the scapula, shoulder of a dog. And you can see how muscle wasted it is. And then you can look at the picture of the German Shepherd below, which actually looks like it's pretty healthy, but just look at how much weight is sort of being loaded onto her hips. This is Jerry. Jerry has osteoarthritis in all of her joints, but it's so difficult for her to even stand. So we have to make sure that we have a realistic concept of what we're starting with, and then we can move forward. So always good to have a conversation with your vet. During COVID, I think video conferencing, photos, I've asked so many owners for photos, pictures, videos to really help explain what the patient is going through. And then another thing that sometimes owners think that their patient is in excellent shape, but you could probably tell that this German Shepherd, when she is going to try to sit down, which she might be attempting to do at this moment, that she's probably going to just lose the ability to do a slow, gradual sit, and she's going to end up just flopping down on her butt. So all these are good markers to continue going forward to actually gauge the progress that they're making. All right, let's start my weight management speech. So these were two of my patients, Belle and Ella. Belle is the chunky lab. We call her a flab on the left, and her new puppy sister on the right. Now you can tell just by the way that they're sitting, the difference in probably the strength of the muscles they have around their hips and their knees. Belle cannot really, she probably sank really hard onto the floor for this sit picture. She can't sit squarely anymore because she's overweight. It's also, I remember this day, and she's panting. So just the effort to get her to sit caused her to open mouth breathe. And her sister is sitting there smiling for the camera. I grew up, and I apologize, I could not find a better picture, but one of the first body condition system scoring came from Purina. And they score body condition between 1 and 9. Between 4 and 5 is perfect. And I always tell owners that you should be able to see, but not, you should be able to feel, but not see the ribs. They should have, if you're looking down at them, an hourglass figure. If you're looking at them from the side, they should have an abdominal tuck, like they're sucking in their gut, like most of us do when we're getting ready for a photo. Some other body condition scoring systems go from 1 to 5. I kind of like 9 because one size does not fit all. But it really is important to maintain perfect body weight. And I also applaud Purina. They were the first group to actually study lifespan of dogs. And they took paired litter mates, and they did this study for almost 14 years. So they took 2 equal litter mates, and they let a dog sort of free feed, and they let the other one feed just enough to actually maintain perfect body condition, that 4.5 score. And what they found was that every single paired litter mate that was 4.5, almost perfect with body condition, lived almost 2 years longer than their sort of overweight, chubby litter mate. And with that population, if they were to develop anything like osteoarthritis, hypothyroidism, endocrine diseases, etc., it took them 1.5 years longer to actually get diagnosed, show signs of that disease. So again, the best thing you can do is never let your animals get overweight. If you do, work with your vet to get the extra flab off. Really important. So this is also additionally, perfect body weight patients, you can actually decrease the amount of medications that they are on. So it really does help, even in your pocketbook, to help keep these patients healthy. All right, so here's Jack. Jack is one of my favorite patients, and I'm not sure if this population that's listening to me is probably 99% dog, but there are a few eager cat owners out there. And what is really amazing is that you can get a cat to exercise. So Jack had a femoral neck fracture. He had surgery on his hip. You can see part of his butt is shaved. And Jack, even though you think he wouldn't work for anything but a mouse, actually loved Sharpie pens, and we were able to clicker train Jack. He does appear in a lot of my movies because he was a superstar. So just getting an animal to walk over broomsticks, if you will, ladder rungs, is a form of exercise, and we will talk about that further on. Now, one of the things that is missing, there is formal rehabilitation for your pets. During COVID, it became increasingly difficult for, I think, the supply and demand side to keep up with each other. But one of the things you should know if you're doing any form of exercise at home is to make sure that your pet is actually up for it. So if you guys know how to take a pulse, that's one good thing, but the easiest thing is to lift up the gums. That dog's mouth is nice and pink and healthy. It's glistening, it's well hydrated. So if they are bright red, if the dog is panting, you know you're going to probably have to take a break. Stop, regroup, consult your veterinarian before you move forward. Another thing, and I'm just throwing this in here, I don't know when there is an appropriate place, but assistive devices have come a long way. Initially, people kind of thought that wheelchairs were the end. You know, he can't walk anymore, he needs a cart. And it's actually, we actually need to put the cart before the dog and before the disease, because a lot of these dogs, if they're recovering from back surgery, leg surgery, etc., the more that they sit in a pile and don't interact with their family really is a detriment to them. So this dog actually, this is Buddy, and Buddy was actually, he had a back issue, and he was paralyzed for over 9 months before he actually got his ability to walk back. But one of the most important things that I think was that with a cart, he was able to maintain his position in the family, his position as the family dog. His head was still with it. It was just his hind end wasn't. So being able to cart around hind limbs and keeping dogs upright is really a fantastic advance for patients. So it can be good for very short-term use. So I will just put this joke in there because there are all types of pain. Now, everybody is probably spending a lot of time at home Googling, but one of the big things, if you have an acute situation at home, that probably does necessitate a trip to the vet to figure out what is going on. But with chronic pain assessment, we're talking about the chronic shoulder injury, elbow arthritis in large breed dogs. Talking about a French bulldog or English bulldog, they have their own issues with joints since they're compact into small packages, etc. But these are the validated chronic pain assessment tools that are available today. And I'm going to point out the Canine Brief Pain Inventory. It was actually invented at the University of Pennsylvania, Dottie Brown. And it is an inventory of owner assessment, which is so important because when patients come to the vet, you're getting a dog or a cat who has so much adrenaline on board that they're not going to limp in front of the veterinarian like they do at home. I can't see them try to get onto the couch or onto the bed or into the car. I can see them walk around stiff-legged, look at me like, I'm the enemy. And so this is a very good sort of lifestyle assessment. Anybody can Google it. It's free, and it really does help not only with quantifying what's going on, but also when you're making progress, how far you've come. Second is the Feline Musculoskeletal Pain Index. And again, I don't know how many cat people there are out there. Cats, they don't follow any rules at all, but a group at North Carolina State University came up with the Feline Musculoskeletal Pain Index. Duncan LaSalle is probably one of the most premier feline chronic OA pain researchers on the planet. And he came up with this, and it's really a great tool. Again, owner assessment, so log on to painfreecats.org. You'll go through the algorithm. And yes, this is my cat here. She's actually sitting on a PEMF pad getting treatment, but don't tell her because she doesn't know. And this algorithm will tell you, yes, actually your cat is probably suffering from osteoarthritis and you need to make a trip to the veterinarian. All right, so what can you do at home? Well, we're going to talk about cold therapy, heat therapy, manual therapy, PEMF, and therapeutic exercises, which are my favorite, because the whole point of relieving pain is so you can exercise, right? So if we have arthritis or if we have some injury, we need to manage our pain, but then we need to go to the gym and do exercises. So you have to have really good methods to work on animals' pain at home and then build up muscle mass. And also eliminate stress. So this is not going to be a lecture about eliminating stress because there are so many aspects of stress and anxiety out there: separation anxiety, travel anxiety, thunder anxiety. But I will direct you to the Calmer Canine, which has really been a fantastic breakthrough in effective drug-free maintenance. My practice over the last 10 years has morphed from in clinic, in New York City, in home, physical therapy, and lastly, shelter medicine. And I will tell you that anxiety exists in all of those, much less at home, of course, but you can't control the weather. You can't control dog and cat or other pet anxiety. But the Calmer Canine has really been a breakthrough, and you should watch. There is a fantastic YouTube video on how much the Calmer Canine has done. And it's the same technology as the PEMF pain relief device we're going to talk about. So ice therapy. Cryotherapy will decrease muscle spasm. So if you have a cramp that's spasming, and ice will decrease the muscle metabolism, and it will decrease the byproducts that are produced, which actually act as irritants. It causes the muscle to actually contract and inhibits inflammatory mediators from being produced, and also will decrease the nerve conduction velocity, which transmits the pain signals. So all of this combined results in pain relief. So uses for cryotherapy are pain, swelling, edema, muscle spasm. And you can use ice. It's best to use it in the early first 72 hours of pain management. So after surgery, After a day like today, you take your dog to the park, you throw the Frisbee 10 times, all of a sudden your dog comes back limping. That's an indication for ice. Overuse and exacerbations, weekend warriors, etc. We use ice therapy for post-operative wound management. It's really fantastic. You can make homemade ice packs, 1 part alcohol to 2 parts water in a double sealed bag. You can grab a bag of peas out of your freezer, which is fantastic because you can bend those peas sort of around the leg. And one other thing about ice therapy is that it works best and actually penetrates the skin deeper if there's compression. So don't just lay the bag of peas on there, sort of hold it down, wrap a towel around it, etc. The opposite would be heat therapy. And the effects of absorbed heat are to decrease joint stiffness, relieve spasms, swelling, and increase circulation. So if you look at, this is another photo of Jerry. When Jerry would come in for therapy, she's an old arthritic dog. She's not really running around the park. But before I can actually do any exercises on Jerry, I need to loosen up her muscles and her tendons. So we need to enhance blood flow to those areas, which actually increase collagen extensibility, decrease joint stiffness, etc. So when I get her limbered up, it's just like any other athlete before they're going to go out and run, or the Olympics are coming, so balance beam, whatever they're going to do, just sort of warming up all those muscles really does help. So we can actually get them moving and do exercises. So manual therapy. One of the interesting things is if you have, let's start with our active athlete. If you just, while they're laying on the couch, sort of go through every joint that they have, start at the feet, sort of manipulate their toes, bend each one. And this is sort of a test to see how well they are feeling and healthy. If they're laying down and you're sort of manipulating each joint, you can begin to get a sense of every joint function for every joint on that dog. The other thing that you're doing is actually increasing blood flow and increasing lymphatic flow and flushing toxins away just by doing that passive range of motion. So passive range of motion is actually where you yourself are putting a joint through range of motion. And it should be very comfortable. So your dog or cat should just be sleeping on the couch and not even wake up. Active range of motion is when you are sort of putting them through a little bit more of a rigorous exercise, and they are also working themselves. So let's take a dog that's standing up, and as it's a very simple exercise, but if you're standing above them, they're standing up, you just put your hand on their hip and push down. They have to contract, they have to balance away from your hand. They're using their core to sort of strengthen and not get pushed down to the floor. But that's an active range of motion exercise that really isn't concussive. But it really does help to bring blood flow to the area. So let's talk about massage, that for years and years really was thought of as a she, who cares, who needs it. I think almost every athlete on the planet gets a massage when they're done exercising, because systematic massage can increase arterial, venous, and lymphatic flow. Again, it's going to flush away those toxins when the muscle is exercising. We want to get rid of those byproducts. Massage also, if any of you have fallen asleep on the couch, I remember my mom would always fall asleep on the couch, and when she'd wake up in the morning, she'd have like a crick in her neck, right? Because you slept wrong. So massage is really fantastic for breaking down and preventing tissue adhesions, which really hurt. You have a knot in your muscle in your neck. It also, through sensory input to the peripheral nerves and muscles, you can actually achieve central relaxation. So all this peripheral stuff moves up to the brain, and you can release endorphins that way. So massage is actually, and there's several different methods of massage that all do different things, but what they do combined together is they will decrease pain, increase relaxation, and I think we all feel better having massage afterwards. Now, why did we, our sponsor tonight is the Targeted Pulse Electromagnetic Field Therapy device, which is fantastic. I learned about this therapy when I was working in a rehabilitation clinic in New York. And PMF is an active electromagnetic waveform delivered by antenna, and it cannot be felt. All the different versions of PMF are differentiated by parameters of their waveforms that they emit, such as the antenna size and the duration and the frequency. And this all determines the strength and efficacy. Now, one of the things is this does not cause heat or it does not cause a muscle contraction. And if anybody's wondering if it's actually safe or not, this is 1/1000th the strength of a cell phone. So if you can walk around with a cell phone around your animal, which pretty much I think 99% of the people do, this is very safe. And what Assisi has actually proven in their research is that it very much mimics the human studies, that it has very strong anti-inflammatory activity. It reduces pain and edema. And one of my favorite parts is that it decreases the amount of pain medication, especially opioids, needed to control pain. And I'll just quickly go through two of the studies. This one out of North Carolina State University, which is recent in the last couple of years, is they took dogs that were completely paralyzed, grade 5 out of 5, that could not walk or feel their legs. And they were actually treated with PEMF therapy. So that was 15 minutes every 2 hours before they actually went into surgery. And then following surgery, they received PEMF therapy for 2 weeks straight, and then twice a day for 28 days. And they monitored pain sensation. They monitored blood biomarkers to figure out if they could come up with a cage side test to give owners a prognostic indicator if their patient would ever walk again. And they followed walking and neuro assessments. And what they found, and if you look at the lower picture, that is a threshold pain stimulator test. They just put an algometer on there to see how much the patients can feel. It decreased incisional wound pain significantly. And these paralyzed dogs, if any of the audience has ever had one, we know about proprioceptive placing the paws. So when they know where their feet are in space, they were much better in the PEMF treated category by day 42. Because some of these dogs, like I mentioned, Buster could not walk for 9 months. So 42 days is a far cry shorter than that. And then the blood biomarker was amazingly lowered in the PEMF group, and it did follow the dogs that were actually able to walk quicker, which is great in a very paralyzed dog. Then the second study performed at the Animal Medical Center in New York City took grades 2, 3, and 4, back pain and paralyzed dogs, and they treated them similarly, and they followed also neurologic scores, wound healing, pain scoring, and all the PEMF treated dogs did so much better. And the other thing is they actually monitored how much codeine these dogs took, and it was almost twice as little as their non-PEMF treated dogs. And these were all double-blinded studies, so they actually used a loop that didn't have an active signal in it. And this paper actually, this research actually won an award and also was published in a big veterinary journal. So what do we know about our treatment, which also is our prevention plan and protection plan? So we know that ice is our friend in the initial 72 hours, heat after the initial 72 hours, massage is fantastic, PEMF therapy is fantastic, and we're going to talk about our exercises in 1 second, and weight management. Really, really important for every condition out there. So therapeutic exercises are actually the cornerstone, even though I love pain modalities, but this is what actually makes them better. The other stuff makes them pain-free so they can do this stuff. So they are the cornerstone of rehabilitation. They work on strengthening, balance, coordination, retraining, especially in the neurological dogs. And then you can use that for conditioning. So let's talk about some basic exercises, which you can do at home. So we should actually start with the dog. So this is Finnegan. Finnegan was our model for most of these. Finnegan on the right is doing a 3-legged standing exercise. And this is an example of an isometric exercise, which it's a type of strength training where the joint angle and length don't change during a contraction compared to a concentric or eccentric, like a shortening, like a biceps curl or a triceps exercise. So you see Finnegan, he's just standing there on 3 legs. Now, that's my hand. I am not supporting his weight. He is supporting his weight on the other 3 legs. So isometrics are done in a static position, not dynamic through range of motion. Then, so you can go around and lift up each leg. And Finnegan's like, hey, I'm done with this one. Let's move on. Then you can go to the paraleg standing. So pick up 2 opposite legs. And he is supposed to balance on them. And you can pick up 2 legs on one side, hind limbs, front limbs, etc. But again, you are not supporting the weight. The patient should be supporting the weight themselves. Then you can graduate. This is plank. And that underneath that purple yoga mat is actually a Reebok stepper. Anybody who's old enough to have one under their bed, drag it out. So it's literally just having the patient put most of the weight on their hind limbs. So excellent for hip osteoarthritis, excellent for back dogs, also excellent if you have a patient with front limb injuries, to take the weight off of that, because looking at that patient, you can understand that 60% of the body weight is carried on the front limbs, 40% on the rear. So these little things you can get on Amazon, sort of the same thing. And the technician is doing that. I was talking about putting weight on the hips if you're standing above them, just sort of moving them around. The other thing that's nice about these little balls are that they have tactile feedback. So any dog that's experiencing sort of nerve delay from osteoarthritis or nerve injuries, brachial plexus injuries are common in some athletes, or biceps injuries, etc., is that those nubs on the balls provide proprioceptive feedback to the brain. Like that. Continuing with that is BOSU. Now BOSUs are not, they're not cheap. There are, BOSU technically is this on the right, and it's a very flat bottom with a bubble top. Again, these proprioceptive nubs, and this is a dog you can tell was shaved for IVDD surgery, and the technician is running the paw through those nubs to provide proprioceptive feedback. And look at that dog is working. It's just a silly little air-filled bubble. But that dog is working hard to stand. And the dog on the left this is a cheaper version of a BOSU. It doesn't have a flat bottom, but it's a very thin pad, and just walking over it. And you can see, first of all, the dog is focusing on what it's doing. Second, the angle of those joints climbing up onto that and climbing off are exacerbated. So it's exercising more than just the dog taking a leisurely stroll around the driveway. Then we can graduate to uneven surface balance. So this dog is just balancing. This is an air mattress. If anybody has one of these, very inexpensive. And dogs actually, we had one for years. Dogs don't puncture it, but the technician can also see what she's doing there is sort of making it a little bit wobbly, so the dog has to focus on core strength. And then you can also do that where you put your hand on top of the hips, just press down a little, so they have to disperse their weight to the other limbs. Now we advance to walking across this, and you can see that dog is a little wobbly behind. It's ataxic, it's had some back issues, but just walking across that is fantastic. And the dog doesn't even seem to mind that it's walking over this bubbly mattress, but a very good exercise as well. Bear bells and cavaletti rails. So bear bells are exactly what they sound like. You can get them at REI. They're for hikers to wear in the woods, so they can alert. I'm not sure that it alerts the bear that the hiker's there and go away, etc. Luckily, I've not run into one. But just placing this band on this dog's leg will do a couple of things. So let's just say this dog has arthritis in the right hind knee or hip. So putting that band on that leg will make that dog say, oh my God, what did she do now? I want to take this thing and get it off. So it will put its weight on all the other limbs and lift up that right hind limb and try to shake that bell off. So that's doing exercise, non-concussive. The dog is doing it of its own volition, so it's not going to hurt itself. But then you can take that bear bell and put it on the good leg. So what will that do on the good leg? Let's say we're going to switch that bear bell to the left hind leg. Now it's going to want to get the bear bell off the left hind leg. It's going to lift up the left hind leg and shift its weight to the other three limbs, one being the arthritic right hind limb. So it's putting more pressure and more weight on that limb so as to build muscle strength. Then we take this little pug over here who you could tell, you can just see before we even start the video, it's had back surgeries, it's shaved. It's also kyphotic, the spine is sticking up. So it's had some neurological issues. So cavaletti rails are a fantastic exercise. Now this is a very inexpensive setup with cones from Home Depot, drill holes in them. Those are little PVC pipes. You can use broomsticks. You can use a ladder laying down. You can use really anything. It's anything, just like the football players when they're running through the tires. It is actually making sure that people are, and the patients are thinking about what they're doing. Now, normally on a day-to-day basis, hopefully we don't have to think about walking through something. But if we're going to walk over rails and see what we're doing, we're going to focus. We're going to pick our limbs up higher than we normally would, which is what this pug is going to do. It's excellent exercise. So you can tell that dog has some issues with hind limb strength and just getting it to walk, pick up its limbs. So, and also hitting the bars as it's walking through is going to say, hey, I need to pick up that limb higher. So cavaletti rails are really a fantastic exercise. And excuse the little piddle at the end there, always happens. Sometimes when you got to go, you got to go. So it's really important when you're doing all of this good work, you want to have an activity scale. So you want to write down everything you did. You want to write that before treatment, you used heat to limber them up, get them all happy and feeling good so they can start exercising. Then you want to say, I went through cavaletti rails 3 times. I walked on the Bosu. I did this, I did that. How many times, etc. Because at the end of the day, after you ice down their joints that you've just used, you're going to see how tired they are that night. So if they sleep for hours and hours, you know you've kind of probably overdone it. So you need to backtrack. So go to your log, see how many repetitions you did, how many exercises you did. If they're not tired, then you can build on that. You can say, well, 2 days ago, you did 5 repetitions. Let's increase that to 7 or 8, etc. So this will also help because our memories are all over the place. We have so many sensory inputs these days. Writing it down, then you can prevent it if you come to a plateau or a setback. You can talk with your veterinarian or therapist about, we were doing this amount and all of a sudden, we had to stop because. So now, if we are in a formal rehabilitation program at a facility, we would send home exercises and tell you not more than 3 exercises 3 times a day and to keep a log. But you're going to be doing a little bit more than that if you're trying to rehab your pet at home. But just remember, 3 exercises 3 times a day is a good place to start. Now, this is such a big topic. I'm just going to mention it just because it was in the blog. But basically, supplements, what are they? So as described by the FDA, a product intended for the ingestion that contains a dietary ingredient to add further nutritional value to a diet. So that could be vitamin, mineral, herb, botanical, etc., which is a little bit different than a nutraceutical, a non-drug substance that is produced in a purified or extracted form and administered orally to provide compounds required for normal body structure and function, hopefully to improve health and well-being. So the problem, and this, we could lecture on this for hours, is that even though the FDA describes what they are, supplements and nutraceuticals are not heavily monitored by the FDA. So necessarily what is written on the bottle is not necessarily inside the bottle or readily taken, ingested into the body and actually doing what it's supposed to do. So if you're going to spend money on supplements or nutraceuticals, you should know who the company is. You should do any type of Googling that you can. You should look for research studies to prove that that product works. It is absorbed correctly. It goes to the joint or whatever organ it was intended to do. So it's just really important now, because I think most of us sat home during COVID and we spent so much time online. And a lot of us, we got to spend more time with our pets. So we're trying to learn all this stuff. Just be careful about what you're buying out there, because these are the substances that are all over the internet, and some are really, really good. Just need some research. So if you look at the top squares, these are all joint supplements that have been proven to work, depending on what formulation, who the manufacturer is, etc. And the other topic that we don't have time for tonight is CBD. Huge topic in not only human medicine, veterinary medicine, etc., because what is necessarily written on the bottle is not what you get or what works, or in some states, what is actually legal these days. So just be careful. So in conclusion, we talked about weight management, probably the #1 thing right off the bat, something that you could easily do that will extend the life of your pet, which is what we want, and more comfortably. That any type of trauma, surgery, osteoarthritis, we want to work on pain relief, controlled exercise, modify their lifestyle and individual care. I found it always interesting when people are coming to see me for arthritis treatment that they would say, well, blah, 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 blah. And then he couldn't get up on the bed, or he couldn't jump up on the counter to get his food. So he put the food down on the floor. He couldn't jump up in the car, so we got a ramp. Now, while those are good lifestyle changes for acclimation, that's the kicker right there that you say, okay, so they can't do what they used to do. Now is the time to visit your vet, come up with a rehab program. They're losing muscle mass and muscle strength. That's the time you want to get really involved in what's going on, so they don't have to lose more muscle mass. One of the things about cats, and I have a video somewhere, I can't seem to find it, but if they're able to jump on the counters or on beds or on couches, but now when they jump down, instead of spryly hopping off, you'll notice that they just put their paws sort of down the side of the counter and then slide until they have to land on the ground. So these are all the timing points to say, okay, my pet needs me to get involved with them. We learned about ice, heat, massage, and PMF therapy, which are all fantastic. You really can't do any damage with any of them at home. Fantastic. And then therapeutic exercises to enhance core and skeletal muscle support and reverse atrophy, which is really important in our pets, especially important in our larger breed pets if we have to start carrying them around. It's different if you have a little 6-pound Yorkie or a 4-pound cat, but those 65-pound Dobermans, you want to keep them exercising.